Welcome to today's webinar on Alelo's Rapid Reskilling Initiative for Public Health Workers. I'm Louis Johnson, the host of Alelo's webinar series. I'm speaking to you today from Hawaii, one of the places where the COVID-19 pandemic is pretty much under control. The public health system here has done a good job. We know in many parts of the world, public health systems have struggled, and part of that is due to the lack of suitably trained public health workers. So we're going to talk today about our technology initiative that can help to address that problem. So my background is in artificial intelligence in education. I founded Alelo to be able to make AI-based learning technologies available at scale to learners around the world. And we have had over 500,000 people using Alelo products in a number of countries to date. So, and a common theme of the products that we develop is that they incorporate avatar-based simulations, AI-driven avatars that you can use to role-play different types of face-to-face conversations. We use this for teaching cultural skills, we use it for teaching foreign language skills, and we're increasingly using it for training occupations that involve a lot of interaction with customers, with patients in the case of healthcare. So we're all aware of the challenges that health systems have faced, highlighted by the COVID-19 pandemic. And we've seen one challenge after another. So in many parts of the world and in some places even now, there were shortages of frontline workers to combat the surges of infections. Then we saw a sudden demand for contact tracers. So last year in the United States, there was suddenly a need for 100,000 contact tracers. Prior to that, there were hardly any contact tracers. Then there was a sudden demand for vaccination workers, and that is ongoing. Now we see a sudden need for people who can go out into communities and persuade people to get vaccinations to combat vaccine hesitancy. And all this is happening in the context of a worldwide shortage of qualified healthcare workers. So the World Health Organization projects that by 2035, there will be a shortage of 12.9 million healthcare workers around the world. So this suggests that if we don't do something, we'll be poorly prepared for the next health emergency when it comes. We also see a crisis in the workforce in the post-pandemic economy, where we see that COVID-19 has increased the gap between skills in the workforce and available jobs. Some of that is because jobs are changing. So many in-person jobs have transitioned to virtual or hybrid formats. So this means that workers must quickly learn new skills, especially in digital technologies. And many workers are displaced. Many jobs have been eliminated. And so workers, for example, most unemployed workers in the United States are now considering reskilling to a new occupation. And so that raises the question of, well, how can they do that? And how can we help accomplish that? There's going to continue to be an urgent need for public health and medical workers. Fortunately, we found that artificial intelligence can help with these issues. First of all, AI-based systems can help train new skills quickly. It can also help retrain workers for new occupations. It can help prepare and certify trainees for new occupations. So our objectives in this initiative are as follows. We want to be able to provide solutions that rapidly augment the public health workforce with community health workers. Community health workers are typically people from a community who have knowledge of that community, who work in that community to promote wellness and public health. We focus on these workers because this is a good entry point into the healthcare system and a good way to augment the capacity of the healthcare system. And healthcare workers, community health workers are needed whenever there is a new disease outbreak anywhere in the world. Our goal is to reskill workers for public health and other high demand occupations so we can augment healthcare system capacity globally wherever it is needed, and then to expand to reskill workers for other occupations where there are unmet needs. So we're focusing right now in this initiative in the United States in our initial trials, but our intent is to expand this globally. We think that this can be delivered globally using digital technology. So first I'll give you a bit of a video that illustrates the approach that we are using to reskill workers.
The world is changing faster than ever, and if we're going to get people back to work and prepare them for the modern workforce, we need a better way to rapidly teach them new skills. That's where Alelo comes in. We believe Alelo's AI-driven experiential learning is the key to large-scale rapid reskilling. Learn more at alelo.com. The world is changing fast. The world.
And this initiative, by the way, is been selected as one of the qualified teams in the X Prize Rapid Reskilling competition. So we are one of 10 teams who are now working to train reskill workers for new occupations. We're the only one in the competition focusing on healthcare. And so our goal is to train workers at least twice as fast as typical programs require, and to successfully place people in jobs that use their new skills. And if we do this successfully, this can make a big dent in the skill gap in this country, particularly for lower skilled workers. And this is actually an approach, a technology that we have already developed and applied in other areas, particularly in rapid training of foreign languages and cultures. So Alelo got started creating immersive games that military personnel could use to quickly come up to speed in how to communicate with people in another country by basically games where you had to speak the language and behave in a culturally appropriate way in order to succeed at the game. And we had a number of success stories from this work. This from a retired Army Colonel, Dan Wilson, who reported to me some of his experiences. He learned Arabic before deploying to Iraq from Alelo's tactical Iraqi game. It worked so well for him that then when he took a battalion into Afghanistan, he had everybody in the battalion train using Alelo's Dari and Pashto games. And what they found was because those soldiers were able, when they arrived, they could engage very effectively with the local population, they were able to build trust and make real progress toward peace and stability. And one indication of that is that when that battalion arrived in Afghanistan, initially there were multiple insurgent attacks per day. By the time they had left, it had gone down to 1 or 2 per month. And Colonel Wilson explained to me what he saw as the reasons for this, why this training was so effective, is that it helps people practice in realistic situations. So when you experience the situation in real life, it feels like you've already done it before. Not only do you have the skills, but you have the self-confidence that you can apply those skills and succeed. So these have proven to be very important and powerful benefits, and not just in these kinds of situations. In fact, our work has gone on. We've now created cultural training products for the US Department of Defense, for And these are now required training for US defense personnel deploying to 86 countries around the world. There have been large numbers of trainees to date. And in fact, the number of trainees increased fourfold last year when the COVID-19 work at home orders first were announced. And so overall for 2020, there was 3 times as much usage as there had been in the previous year. And we've also had success applying this to teaching communication skills at the higher education level. So one of our partners, Laureate International Universities, they are a network of universities around the world, principally in Latin America. And we've worked for some time with the UVM campus in Toluca, Mexico, and they've had great success with it. And their instructors report that it helps their classes because the students come better prepared, but very willing to engage. And so their classes become very communicative. They can see that it helps students who need to build greater self-confidence in speaking English. And this avatar-based approach, it appeals very well to a younger audience. In fact, one of the teachers said, gee, I wish I had this when I was a kid. It would have been a lot of fun. So we've developed our capabilities now into a platform called Nskill, which we use in these different applications, including public health now. And it has a number of capabilities that all rely upon artificial intelligence. So as I said, you can practice with AI-driven avatars in a safe environment, meaning that it doesn't matter if you make mistakes. So this is part of why this approach helps develop people's self-confidence. As you interact with one of these avatars, the system is constantly measuring, assessing your performance. So at the end of a simulated encounter, you get feedback on how well you did, and also personalized learning guidance, recommendations of further practice exercises that you can do in order to work on the skills where you need further improvement. And it also provides analytics to learners, as well as to teachers and to learning organizations. And these analytics have been one area where we put a lot of effort in during the COVID-19 pandemic, because as educational programs went online, teachers wanted a better way to be able to track what the learners are doing, track their progress. So we've developed a series of analytics on multiple metrics that have proven to be very helpful for instructors and help make blended learning work well. Nskill is as much a data collection tool as a learning tool. And so this makes possible a new way of developing learning content, an approach that we call data-driven development. So the idea is you create an initial prototype, and then learners get on it. And as the learners are interacting with it, it is collecting data, collecting their responses. Then we collect up those responses, use those to retrain the models. So as more and more students use the platform, the AI gets better and better. And this has really been key to our success, particularly in our English language training, where we have students from many countries around the world using the platform. And as more students from more countries use it, it gets generally better at being able to understand and respond to learner speech from people from various native languages. There is an article in the International Journal of AI in Education. If you'd like to read more about this, I encourage you to do so. That also includes some results from some of our iterative evaluation studies that show how system performance improves over time. So in the case of community health worker training, what we have done is create a number of simulated cases, simulated patients that you practice interviewing, providing information to. The common focus of much of this is dealing with aspects of the COVID-19 pandemic. The reason why we chose that is because this is in the forefront of everybody's minds. And we have lots of realistic cases of training, of COVID-19 response that we can incorporate into our training. We put a lot of emphasis in practice from the very beginning, because we see that this is a big deficiency in a lot of academic programs in this area that focus a lot on, say, medical terminology, on background knowledge relating to the profession, but don't really give you much of an opportunity to practice. We think that learning by doing is extremely important here. And so the more that we can create simulations that simulate cases, the more that we can present cases for learners to watch, to discuss, to study, the better prepared they will be with real competencies when they enter to the real world. So I'll give you a demo in just a moment, but before I do, I want to review what the real objectives are here in terms of learning outcomes. And they basically are what community health workers are expected to have is a set of competencies that help them do their job. By the way, if you don't know the kinds of things that community health workers do, here are some examples. They provide culturally appropriate health education. They engage in care coordination, case management, system navigation, helping ensure that patients stick with a treatment program, provide coaching and social support. And as you'll see, a common thread in a lot of these is communication. Communication skills, interpersonal relationship building skills, these are really at the top in terms of the skills that a good community health worker needs to have. So when we looked at this occupation, we say, well, okay, we already have technology that helps people develop communication skills. Let's see how we can apply that in the context of public health training. So now I'll show you the actual course so you can see a bit of how it works. So what we do is students register online. We organize them in groups so that we can engage them in group work activities and also give them webinars, materials to view, as well as interactive learning content. And that's what I'm going to show you now. So I'm going to launch actually, I have the Nskill server right up. So let me just go to it and then we can go into it. By the way, I'm listed as instructor on a lot of different Nskill courses, so you can kind of see the range of different courses that we have available. A lot of them teaching English or teaching Spanish to English speakers. And so this is now our first product that's really focusing on public health.
This module trains people quickly to become good COVID-19 contact tracers. Contact tracers call people who may have been exposed to infections like COVID-19.
So we're going to go through an initial module here where you get started in engaging in contact tracing. So as I said, contact tracing was a big part of COVID-19 response, but it always is an important aspect of any public health emergency response. Whenever there is a new infectious disease, contact tracers help to identify and document its spread. So we're using contact tracing in COVID-19 as a way of introducing people into public health tasks that they will need to learn to perform. And also a contact tracing interview can involve a range of communication skills. In order to be successful as a contact tracer, you need to develop trust with the person. You need to explain to them what they need to do. You need to explain the rules regarding confidentiality of healthcare information. So just within this one task, you can apply a bunch of different community health worker skills. So basically what we've done here is we created a series of modules that focus on different aspects of a contact tracing interview, and then go into those in different levels of difficulty. So within the same basic scenario, we can, the patient can be more or less cooperative. So this is a way, through a series of cases of increasing difficulty, we steadily build the trainees' competencies. So this is a key aspect of our methodology here. So let me go in a little bit farther here. So to begin with, let me open this up a little bit. So now let's...
The course begins with a few simple case studies. First, you are presented an example case of contact tracing.
So this is the idea. We present example cases, and then you start practicing the skills that are illustrated in that case, and then you actually get an opportunity to work through a case yourself.
In the following scene,
Hello?
Good afternoon. My name is Sarah Hernandez, and I'm calling from the Department of Public Health. Is this Ms. Rodriguez? Initially, address the patient by their title and last name. If you're unsure, it's a good idea to ask how the patient wants to be addressed.
I'm Miss Rodriguez. Why are you calling me?
I need to speak with you about COVID-19 and your health. Is now a good time to talk privately?
Sure.
Thank you. In this lesson, you'll learn to introduce yourself and establish.
So now we'll go through and it'll explain some of the different skills that you're actually employing here, so you can see what's going on here. And if you want to, you can go back and look at the case again to see how those skills were applied in the case of that example.
The beginning of a contact tracing conversation is simply about making sure the contact knows who you are and that you have reached the correct person.
I'm just going to skip
It is
through
important that the people you make contact with understand who you are and why you are contacting them. After you have explained who you are and why you are calling, the next step is to be sure you are talking to the right person.
So now I have an opportunity to try these myself. So again, key difference, a lot of e-learning courses will talk about what you do. Here you immediately get an opportunity to practice what you're learning. So for example, hi, I'm Lewis with the Department of Public Health. So it says, okay, and actually I'll turn sound back on. I guess sound is on here. And more examples. So am I speaking with Miss Rosalie Rodriguez? So it didn't quite see that. So I can say, well, what would a correct answer here be? So may I speak to Rosalie Rodriguez? Okay, so I can keep practicing until I get an appropriate response.
Health is a very personal. Building rapport takes time, but begin with small talk early and engage on a human level.
So this is a point which is very important and often gets overlooked when contact tracers just following a script of what it is that they're supposed to say. Here, it's important we really emphasize that you're trying to get to know the person, build their trust, and that will make it easier then for you to gather the information you require and also communicate to the patient what they need to do.
Once the one question, some phrase.
So now I'll actually have an opportunity to now start practicing a contact tracing conversation. So this is the first part of the conversation where I'm introducing myself, explaining the reason for the call. Call Rosalie Rodriguez.
Hello?
Hi, I'm Louis Johnson from the Department of Public Health. Am I speaking with Ms. Rosalie Rodriguez?
Hi?
Hi, I'd like to speak with Ms. Rosalie Rodriguez.
This is Miss Rodriguez.
Great. I'm glad we get a chance to talk. I'd like to speak with you about some health concerns relating to COVID-19.
Oh, goodness. What is it?
I'm afraid you've been in contact with somebody who has tested positive with COVID-19.
Oh, my. Is it Luis? I told him he shouldn't be going to those parties.
I'm afraid I can't discuss that. We keep everybody's health information private.
Okay, I understand.
And everything we talk about today will be kept private as well.
Okay, this sounds serious.
How have you been feeling the last few days?
I'm feeling fine. I haven't been sick at all.
Okay, so we stop here. Again, this is just the introduction of the first part of the contact tracing interview. And you can see I have met all of the objectives. I was able to introduce myself, verify that I was speaking to the right person, build rapport, explain the purpose of the call, explain that the health information is confidential, inquire about her state of health. If I made a mistake anywhere along the line, I would have gotten feedback here, and then I would have an opportunity to go back and practice and continue. And these analytics are being recorded up on our server and made available to instructors, to program navigators, so that they can track the progress of the trainees. So I'll just explain in a bit more detail the methodology that we employ here. We call it the spiral staircase model. So we use concrete problems as context for learning. In this case, COVID-19 response. But we emphasize with these problems that the goal is not just to solve the problem, but to learn the competencies that are required in order to solve the problem. So the goal here is not so much COVID-19 contact tracing skills as contact tracing patient interviewing skills. So we introduce skills through cases. Trainees can watch and practice those cases. The cases are tied to the core competencies. And at the end of each unit, we remind the trainees of the competencies that they applied in the context of the case. We engage students in group work to promote knowledge transfer and reskilling. And we find this particularly important for the reskilling aspect of what we are doing. So most e-learning courses, as you know, basically are designed to teach a new skill or a new area of knowledge. They're not often designed to help people transfer what they already know in some other domain to this new domain. And part of the reason for that is, it's hard to predict which occupations learners might come in with, what experiences they might have which might transfer. So here we find group work to be most beneficial. We encourage students to get into groups and share their experiences of how what they learned in previous occupations can help in what they're now learning. And the transfers may not always be obvious. So for example, one occupation that's very helpful for community health workers is retail banking. And you might ask, well, why would bank tellers have an advantage here? Well, bank tellers are working with people in a community all the time. They have an understanding of the financial difficulties that people in the community are experiencing. And so this is all very helpful when somebody is then going to be working in the community to promote public health. Then the spiral part, we actually use multiple cases and we keep coming back to competencies with new cases at higher degrees of difficulty. So to further reinforce these competencies. And then we provide readings, background readings that cover the knowledge that's being learned. But you can see here is that this is a flip of the conventional training methodology that often focuses on the book reading first, and then maybe you get a chance to practice it later. Here, where possible, we focus first on the practical skills, and then you can read further background to learn more about these skills that you're developing. This, we find, is it really is a better way for trainees to learn, particularly ones in this demographic. A lot of these trainees we have, they did not complete college. They're not really, book learning is not really the thing that appeals to them. They like practical skills, but they also like to be able to understand the basis for those skills. So providing the background knowledge support is the right way to go for these learners. So you've seen examples now of how this works, of getting the feedback, and to give you a sense of the analytics and how we use this. And we use this both, these analytics are used both by instructors and by what we call program navigators, who are really people who their expertise is working with trainees and keeping them in training programs. So what the program navigator can do is look at the statistics presented in the portal, identify students who might be struggling, and then intervene to help them. And if the program navigator identifies that there are a number of students who seem to be having problems in a particular area, to then alert the instructor, who then can focus on that particular area. So this relieves a lot of the burden on instructors of tracking each student individually, particularly if the students are performing well. Then very little effort is required to track them. So in this screenshot that you see here, so it's listing total, this is from a trial of with an English class in Sweden. The time listed is the total time spent in conversation. So not the amount of time logged on, but the time spent actually engaged in these communicative tasks. And you can see here that these students all put in a considerable amount of time. We often, though, see in courses that there'll be some students who spend very little time or no time. One thing that we quickly observe is that there are some students who will practice an exercise just once and then move on, whereas there are other students who will practice multiple times to try to improve their score. And it's this repeated practice that we really emphasize. You don't learn to be a good contact tracer just by doing it once. You do it by practicing it enough times that you get comfortable with it. You know what to do. You're not surprised if the patient responds in some particular way. So repeated practice is very beneficial here. And if students do practice, then we can see how their progress improves through multiple sessions. And you can see here some of the metrics that we're tracking, not just the total amount of time spent in a particular conversation, but we're looking at the number of objectives met. We look at the number of conversational turns per minute, because this is a good indication of whether the trainee has really mastered the skill. If they have to stop and think of what to do, then they're really not fully prepared. Another thing that we look at is how often do they rely on hints or suggestions of what to do. So if they are stopping, looking for hints, looking to try to decide what to do next, then their turns per minute score is going to suffer as a result. So these analytics really help us to follow the learning trajectories of different students. Can be very meaningful. So we are now beginning training with this course that I just showed you. We are recruiting underemployed workers in the Hampton Roads region. The Hampton Roads is at the mouth of the Chesapeake Bay in Virginia. So we're recruiting a total of 350 trainees for this initial training, although it looks like we may soon expand that. We've been getting requests from other regions to recruit trainees to go into our program. So we group the trainees into cohorts to train together. Then once the trainees complete the training, we then place them in jobs. So we don't consider our job done when the students complete and get the certificate. We want to make sure they actually get into a public health job and are able to stay in that job. And if our job placements are successful, then our team will advance to the next round in the X Prize Rapid Reskilling competition, where we will scale this up to other occupations and to other regions. And we also have plans to scale this up internationally, starting with countries with centralized health systems, such as Canada and the United Kingdom, where there are uniform standards for community health workers. And then from there, we can expand very broadly. We think we have a model that can be easily adapted and replicated in public health systems around the world, and could potentially make a big difference in terms of health system capacity. And so, as I said here, these are some of the main things that we are looking to do. One way to accomplish this is we're working with nonprofit organizations that fund worker training. The plan is to offer career impact bonds. So what a career impact bond is, it's a bond that pays for the training, and then the workers repay the bond when they get a job. So it's a way to help trainees get training without having to incur costs up front. And then we see potential to extend this to other occupations. Manufacturing is one. And by the way, we see communication skills as being very important in a range of different occupations. And you might not think that manufacturing would be one, but here in the United States, we have a lot of workers in manufacturing who have limited English proficiency. And it turns out that problems in communication in English really get in the way of manufacturing productivity. So we have gotten requests for training courses that really focus on the communication skills that you need to work in a manufacturing setting, what's known as an English for specific purposes course, in this case for manufacturing. So another example where we're working in this area of where communication is an aspect, sometimes for native speakers, sometimes for language learners, but there's a common technological method and approach that seems to work well for these problems. So we cannot do this by ourselves. And so we are looking for sponsors to assist us with this program. And there are different ways in which organizations can and are co-sponsoring. So one is to be a co-sponsor of the Alelo team, and we will acknowledge our co-sponsors in all of our promotional materials. We offer the possibility for to sponsor trainees to cover their training and placement expenses. So this is a method that we're looking at for scaling up training through the program. There are nonprofit organizations that are interested in sponsoring trainees in our program. We also have an equity crowdfunding campaign. You can actually invest in Alelo and N-Skill and help us to build and grow the company. So all of these are possibilities. And if you'd like further information, reach out to me. Here is my email, my contact information, and I would be happy to tell you more. So I will stop screen sharing now. And if anybody has any questions, you can type them in the chat window, and I'll be happy to respond to them. And while you're thinking of questions, I have a question for several of you. I see that we have participants here from different countries around the world. And I'm wondering if you see problems in your country in terms of lack of trained public health workers and how that is impacting response in the COVID-19 pandemic. If any of you have any experience or observations there, I'd be interested in hearing them. Okay, well, it looks like we've got a quiet group today. So I guess we will stop here. We're going to record, as I said, this session and post it on our website. And do follow what we're doing. If you're interested, we will be posting updates as trainees are going through the program and we are having the impact that we anticipate on public health system capacity. So thank you for attending today and enjoy the rest of your week. Bye-bye.